One of the unfortunate statistics that we're seeing now, however, welcome to Getting Understanding with Dr. Darrell Ellis. We're back again, and I want to start out with just giving you an update on the monkeypox epidemic. Things are looking better. We're seeing the transmission rates are going down. The number of cases that we're seeing nationwide also have either plateaued or started to decline depending on what part of the country that you're in. One of the unfortunate statistics that we're seeing now, however, is that we're seeing more children who are being diagnosed with the viral illness, particularly newborn children. In a lot of cases, that's as a result of infected parents who are not aware of the fact that they've got the infection. Then they're, of course, nurturing and parenting their children and passing it on to the children, who then present to local emergency departments and/or pediatrician offices, and the diagnosis is being made. The reason why it's important for us to know this is, number one, even though the numbers are going down, I can't express to y'all how important it is that we follow our basic precautions. Try and keep social distancing whenever possible. When it's not possible, do masking. When that's not possible, be sure that you're practicing good sanitization. Keep your hands washed. Make sure that you're checking yourself for any evidence of any acute illness. And if you have to, be sure that you carry sanitizer with you so that when you're not in a position where you can wash your hands, where you don't have soap and water available, you can always continue to sanitize your hands anytime you're touching a foreign surface, particularly if it's in a public place. We've gotten a lot of questions regarding vaccination against the monkeypox. There is a vaccine that's available. It's a smallpox vaccine, and I think we mentioned this in a prior video. But who's eligible to get vaccinated? It's not something that's being recommended for community-wide vaccination. Certainly it's not something that's considered to be a mandatory vaccination. However, if you're in a position where you are notified by someone who you've been in contact with, or through contact tracing, an agency notifies you that you may have been in close contact with somebody who's been diagnosed with monkeypox, whether you have not developed symptoms or whether you may have very early symptoms, you're eligible to be able to get vaccinated. Also, if you're in a high-risk group, if you're in a group of individuals like men who have sex with men, or people who treat people who have been exposed to and or diagnosed with monkeypox, you also are eligible to be vaccinated. Now, what happens if you miss the opportunity to be vaccinated? You contract the viral infection, you develop symptoms, and you begin to get ill. What do? Well, you go to your local emergency department, you get the appropriate testing done, they'll instruct you to start with your quarantine period, and then if your symptoms progress, there is a treatment option available. It's called TPOXX. TPOXX is an antiviral regimen that they can put you on for a 5-day course, which in many cases will at least abate the symptoms that can lead to serious illness and in some cases death. So things are looking up, both in terms of decreased transmission, increased opportunities for vaccination, as well as a treatment modality that seems to be somewhat effective. So be sure that we're being careful. Be sure that we're taking care of ourselves. These are basic principles that we should have been following even before the pandemic. But now that we're faced with these infectious diseases that seem to be coming one right after another, it's even more important that we go back to the basics. Take good care of yourself and take care of your family. Don't forget, hit that like button, hit the subscribe button, and be sure to press that bell notification so that as we roll out new information and new videos, you'll be the first ones to be notified of that fact, and you can be most up to date on the latest data.